I'm Dr. Dennis Block. I am a emergency medicine physician. I'm a wound care specialist. I have degrees in pharmacy and biochemistry. I'm here to talk about the health hazards associated with CAFOs. Even though it was mentioned that health hazards had nothing to do with this permit, I think people need to be aware of the health hazards that are associated with this. And it doesn't make any difference if you are pro Valley Oaks or you're against Valley Oaks. These health hazards are going to affect you, and if you live within this 3 to 5 mile radius, these things are going to affect you, and you need to know about it. Cattle are given antibiotics to prevent infections, liver abscesses. They're in close confinement, so they're given antibiotics. That in itself maybe is not a big deal to you, but it is down the road, because these antibiotics are excreted in manure and urine. 30 to 90% of the antibiotics that are given are metabolized and excreted in the urine and feces. So what does that mean? These animals also have bacteria, E. coli, Pseudomonas, Salmonella. And what the problem with that is, superbugs are now forming because of antibiotic resistance. So bacteria develop resistance because of low dose antibiotics. They have a mechanism called plasmids. These bacteria can pass on this resistance to their own species and also other species. The CDC today just released a study about superbugs. There are now 11% of the people that they looked at are carrying superbugs. What does that mean? There is no antibiotics to treat these superbugs. So if you are compromised, such as respiratory, asthma, COPD, emphysema, lung cancer, you're diabetic, you have diabetic wounds, you are elderly, you are newborn and have very low resistance, your chance of getting one of these superbugs is high. And an example of that, I have a diabetic patient who has a wound on his foot. He has 6 bacteria in it. All 6 bacteria are resistant to oral antibiotics. So how does that, the CAFO affect that? One, I don't care how you protect your water, these things are going to get into the water system. Water treatment doesn't take out the antibiotics or the bacteria. They treat it, but you know, when you're given your water, unless you run it through a charcoal filter, you do not take out the antibiotics or the hormones. So you have low doses of antibiotics that you're exposed to. That means that the bacteria you're carrying are developing resistance. So what big bug that everybody's aware of is MRSA. If you get MRSA, the amount of antibiotics that are available to treat you are diminishing. And I had MRSA sepsis. I spent 30 days in the hospital. It's not something that's you should just laugh off. So also the manure that's spread on these fields, the bacteria and antibiotics are in that manure, and it gets aerosolized. So a day like today where the wind's howling, that aerosolized bacteria can be spread over miles from the place it's put down on. So again, that's you're exposing the general public to things they don't need to be exposed to. And I believe the Johnson County Department of Health has gone on record to oppose this because of the many people who live in this proximity. So,
Doctor, if you could, you're over your 3 minutes, if you could conclude, okay. And then we bring up the next speaker. Thank you.
The one thing from the CDC today was that 23,000 people died this past year because of antibiotic-resistant bacteria. So I don't want anybody to be part of that.